So here I was. It was near the end of my stay at the rehab hospital. I had I'm able to use a walker. Um, I'm able to eat normal food. My taste was totally gone. I couldn't really see at all. Still had difficulty there. My balance was absolutely horrible. And every time I turned or whatever, the world would spin, and I was still in a great deal of pain. Um, so I was actually okay, I suppose. I can move around and walk. I still couldn't drive. I still needed help to get changed. I still needed help to take a shower. Oh, my first shower. I hadn't taken a shower in probably several weeks. Very, didn't feel very good. Couldn't really wash my hair. My wife gratefully washed my feet, which was lovely. So they actually got me into a shower in a wheelchair. There was a big room that is sort of like the shower room, and I was able to go in there and shower myself, and I was really grateful for that. It's odd when the little things in life are taken away from you, and how you um, forget, how you take everything for granted. Simply taking a shower without having any difficulty. Going to the bathroom. Oh, I have to go to the bathroom. Just going to the bathroom. No one needs to help you. You just go. Washing your hands, shaving. Um, I always use a razor, or always used to use. I'm back to using a razor, but I couldn't use a razor anymore because I was on what was called Coumadin. It was a blood thinner. So if I cut myself, it would be really difficult to stop bleeding. So I had to use an electric razor. I hated using an electric razor. And the other thing is, I couldn't really see my face all that well. So if I used a razor, I guarantee I would cut myself. So an electric razor would help. So I was able to shave. I didn't look very good. I had a friend who told me later, and everything was told to me afterwards because I'm sure if they told me then, I would feel even worse than I did, is that I looked like I was 80 years old. I was only 40, and that the stroke had taken many years off my life. I had black hair before the stroke. Now, this is 12 years later. I'm in my 50s. Of course, I have gray hair. But after the stroke, I started getting significant gray hair. Um, so it aged me a good, I think, 10 to 15 years. The stroke takes a lot of life out of you, and it takes a lot of work to get back to being more normal again, or physically more normal, doing the things you did before. So here I was at the end of my stay at the rehab center. Like I said, I was able to walk with a walker and able to eat normal food. And they said time to go home. I was also able to climb stairs, which was a benefit because my house had lots of stairs. So I get shipped home, and I was really happy to go home. I got to see my son again. I got to see my home again, and my wife again, and sleep in my own bed. Sleeping was one of the worst things about staying at the rehab hospital because it was always noisy, and I couldn't really get to sleep because it was always noisy. I'd put pillows over my head to try and keep things quiet, and a nurse would come in and says, "You can't put a pillow on your head." I would put earplugs in. The lights would always be turned on because they needed to, do blood pressure or give me pills or whatever. It was always disturbed. And that just made the fatigue even worse. So when I got up in the morning, all I wanted to do was sleep again, but I couldn't because you had a schedule. You had to go to rehab. So going home, getting all the lights off was lovely. Even though I was in a lot of pain, it didn't matter. Once I got to sleep, at least I didn't get woken up again. Getting up and getting to the bathroom, if I had to pee or something like that, was tough. But what I did was I refused to use a walker to get out of bed, to go to the bath. I would use the walls. So my hands would go up using the walls to help me get to the bed. I didn't care how it looked. I said, I've got to try. And I would just use the walls to get to the bathroom. And luckily, my house isn't huge where the walls are really far away, but I can follow the wall to the bathroom and sit down and do what I had to do and get back into bed by not using a walker. Getting down the stairs is same thing. I would hold on to the railing to get down the stairs. And then I would use a walker. So one of the first things I did when I got home was I walked on my street. outside, which was fantastic. A friend came with me. I got the walker and I walked, and it was probably about, oh, I would imagine less than a football field, maybe even a quarter of a football field. But I was able to look at the trees, smell the air. It had just rained, and it was, you know, August, mid-August, early September, whatever. I can't quite remember. And I felt alive for the first time since my stroke. Absolutely alive. That I was outside, I can walk. It gave me a sense of freedom that I hadn't had the whole time at the rehab hospital and the hospital since my stroke. And that was actually very important to feel that freedom.